a host as well, so I can.
Here we go.
Great.
I believe we are live. Hey, everybody.
Hi, everybody. Let's see. Did you want to add me as a co-host?
Oh, yes.
I can share my screen.
Sorry for being late, everybody. We are having a little bit of technical difficulties tonight, which is why you see a logo and not my face. But we are working through it. Give me a second, and I'm going to share it into our group here. And then we will be ready to go.
Hi, everybody. Ready? Let's see. I think you should be seeing our slides now.
Yep, we see them.
Okay.
While we are getting all set up here, I'm going to share with you all about Miss Laura Emanuel, who is here with us today, and we are so thankful for her. She is the founder and CEO of Mothership Rising. I'm a big fan. It's a free app that is like a meal train for emotional support for parents in the 4th trimester. She had her own challenges with postpartum anxiety after she gave birth to her son in 2019 and was humbled by the support that she received from the community. The late night text kept her going during tough night feeds, and a simple "you are doing a great job" made her feel seen and appreciated while she was bumbling her way through figuring out if the cry was for dirty diapers or because her kiddo was hungry. The support she received was the inspiration behind Mothership Rising. They are not a replacement for professional support, but an added level of community care. So we are so grateful to Laura for being with us today.
Thank you. I am grateful to be here. It's just an exciting time to be part of this conversation of what motherhood and parenthood can look like. And there's so many really amazing organizations like Cherished Moms that are making huge differences in people's lives.
Absolutely.
So I'll kind of go right into the presentation. I'll just begin by introducing, thank you for that introduction. Say just a little bit about myself, which is my little one, my toddler, is in the next room. Like I'm sure so many of you can all relate to doing a presentation or an important interview or and worried that maybe there might be a guest star. But so if he does make his way in, we'll say hi to him. And he really, in that journey into motherhood, was the inspiration for a lot of what I'm going to be sharing today. And I also want to share that we all come to mothering and parenthood through so many different paths, and we identify with many different terms. I'm going to be referring to myself as a mom because that's my lived experience, but I want to recognize that there's many different lived experiences of people who are sitting in on this call today and potentially listening in the future. You can see here just a little bit of screenshots about Mothership Rising, and towards the end of the presentation, I'll share a little bit about like what we've created. But I want to begin by talking about really our mission and our mission around emotional support, because we really noticed that there was a gap in the conversation around emotional support, and specifically in those very, very early days, postpartum or parenting, when you welcome a new little one into your life, right? That time feels overwhelming and heightened and tender. And that's really where our company is focused in terms of providing support. But I think the conversation that we're having today could be used really at any time in your parenting journey when we're talking about emotional support. So, what I want to begin with is just touching on some of the core needs that we have as humans, right? As humans, right? The need for love, the need for self-worth, the need for freedom, the need for safety, the need to be understood. These often get left out in the talk of planning for postpartum or planning for early parenthood because it feels a little bit like nebulous. How do you talk about this? How do you ask for support in these areas of our lives? How do we even know what we're going to need? We don't. It's kind of a situation where we don't even. Maybe you don't even know what you don't know. Certainly for myself, it was right. And when there is postpartum planning, which is amazing, it often is talks mostly about kind of the practical issues, which are very, very important. And we certainly believe in that. And our support wish list has a lot of those options to share about those practical things that we need as parents and as new moms. But there's also this part that seems to be like scarier to talk about, maybe. So that's what we're going to dive into. If you're ready to dive into this with me, some of the things that might feel uncomfortable or scary to talk about. Right. So the first need that we're going to talk about the need for love, to experience love, to give and receive love. And today's going to be a little bit interactive. As we go through these needs, there's going to be the opportunity to reflect on the need. So the questions I'm going to ask for you, and you can go ahead and you can write this in the comments if you want to share your answers here, what you're thinking about the need around self-love. How important is this need on a scale of 1 to 10? And it's just a little personal assessment of like, without really even thinking about it, how important do I think this is, right? And then what makes me feel loved? And who makes me feel loved? And then what kind of things make me feel unloved? And then how can I share about my needs around love? And I would actually kind of tie that into like, who do I share about? Like the people who make me feel loved. Maybe that's a really great place to go to share about these needs. Now, specifically tying this into that postpartum period, right? Like, what does our need for love look like in postpartum period? How there's some challenges that happen, right? We have 24 hours of care that a baby requires, and it requires deep energy reserves. And again, if anything comes up for you about like how your need for love was challenged in the postpartum period, we'd love to hear about it, right? There's a lack of time for self-care. I remember like reading on the back of my sitz bath, they were like, we recommend you doing this 4 times a day. And I was doing it at like 2 a.m, right after a night feeding. I was like, who has time for a sitz bath 4 times a day? We question our self-value, like we might compare. There's of what others are doing or how they're experiencing the postpartum period. We can question our generational parenting. We can not always feel connected to our baby, and staying in touch with other people requires effort, right? So meeting these needs, what are some ways that we can meet these needs? I really love this first suggestion that came from our community manager, Liz Lincoln, right? Unconditional love from our baby. I think there's a lot of talk about how, connection to our baby and that we're going to love our baby. And I really love the idea of receiving the love from this new little person in our life, and what can happen when we open ourselves up to that and having that conversation. Redefining relationship can lead to understanding some of our deepest needs, because our relationships are changing and it's really apparent at that time. Finding joy in small things when time is limited. I remember lying on my sofa and the front door being open and just loving looking at the trees. Connecting with our ancestral maternal wisdom, seeking the professional support we need, and then accepting our loved ones' offers of support. So these are just some ideas that we've heard from our membership and that we wanted to share with you when you're thinking about ways to meet your needs for self-love. And hopefully these inspire you to think about what's true for you. So we're going to move on to the next need, this need for self-worth and feeling that we're valuable and important. And so we're going to begin again with that check-in, like how important is this need on a scale of 1 to 10? And maybe after we go through these like slides, you'll go back and you'll say like, oh, I thought that was like a 7, but it's actually like a 9, right? When we think about what makes me feel worthy, who makes me feel worthy, what makes me feel unworthy, yuck, and how can I share about those needs, right? So thinking about our self-worth in the 4th trimesters, what are some of the things that challenge those needs? We could feel disconnected from our previous work. Even if we are working, it can feel different, right? I remember going back to work about 11 weeks, and I felt different in that role. We may question if everything we're doing is right. Do we have the answers? Is there even a right? Our hidden anxieties may rise to the surface, and asking for help can feel like a failure. So what are some things that we can do in terms of meeting these needs around self-worth? Right? This idea that we have an immense capacity to love and caretake in the way that is unique to you, right, is really powerful. And we realize we're worthy of the love of those supporting us, realizing we're worthy of supporting, that we don't have to do anything for support, we're just worthy of it. And when we're finding the strength to ask for and accept the support that we need the most. All right, freedom. This is something that we don't talk about a lot, I think, as new parents, right? How important is freedom to you on a scale of 1 to 10? What makes you feel free? Who makes you feel free? What makes you feel confined? And again, like if you had to ask specifically for your needs around freedom to be supported, what kind of questions would you ask for people? How would you ask for support to feel your freest self? And in postpartum, I think the needs around freedom can maybe become some of the most shocking needs or surprising, right? Limited time to recharge, limited focus on partner relationships and friendships that may have really been high priorities before the baby entered into the relationships. Intense demands of bodily space and touching, less control over emotional, mental, and physical responses to stimulus, because so much is happening if you're recovering from birth, if you're recovering from body feeding, if you are not sleeping, right? So that really changes how the body and emotional and mental and physical responses can show up for you. So meeting these needs, accepting gifts of time from loved ones, and welcoming support that reduces responsibility and stress, right? So the friend who says, hey, can I come over and hold that baby? Can we say yes to that? That was really hard for me, right? But leaning into the power of positive attachment to our child, right? And what does that feel like for you and your unique relationships? And encircling ourselves in personal and professional support systems that relieve emotional pressure, where we feel free to speak our truth. So moving on like to safety and security. So we're just going to go into these like self-reflection questions. How important is safety to me? What makes me feel safe? Who makes me feel safe? What makes me feel unsafe? And how can I share about my needs? And in these reflection questions, you might be thinking, if you are recently postpartum, you might draw on your experiences there, especially if you're preparing to, for another postpartum journey, or you're healing from your past postpartum journey. But you can also think about like work relationships, friendships, your family of origin, to help mind really what are our needs here. And then we're going to move also into understanding, two questions as we build understanding when we think about this need to be understood. How important is this need to me? For me, this is a pretty important need. And what makes me feel understood? Who makes me feel understood? Who do I pick up and call or text when I want to feel heard and seen? What makes me feel misunderstood? And then again, how could I put words on these needs? And who would I share those with? Okay, and we've combined this about meeting these needs in the fourth trimester around security and safety and being understood, because we found that there was a lot of overlap here. Right? So meeting these needs, we think a lot about finding comfortable spaces where we can share our truth and be listened to openly without judgment. Without judgment seems to be a really key component here. Cultivating relationships that energize us and fuel us, and putting boundaries around those that don't. Again, the boundaries seem to be like really key here. Trusting our parenting and our internal wisdom about our child and ourselves. Being open to adjusting our expectations of ourselves and our child, right? Remembering that we're human, they're human, and we're getting to know them, building a relationship with them. And trusting our support systems to lift us up by openly receiving the support we need without guilt, which I know is a barrier, right? One of the biggest barriers to asking for support that we hear and we see is this feeling like we should be able to handle it all. That might show up like guilt or shame or anxiety, right? But there is this imprint and expectation that we see from a lot of people of saying like, oh, I'm failing if I'm not able to do it all. There's an expectation. And then the barriers to offering support is what we hear is not knowing how to help. There's so many people want to help, but they don't know how, right? And so that's where what we did with Mothership Rising, right, was to create an emotional support calendar. It's a really simple idea. There's a support circle with your friends and family in that, your trusted community members, whoever you would turn to, right? Answering that question, who do I go to feel understood? Who do I go to feel loved? Who do I go to for safety and security? Who do I go to for freedom? And these people, it might be all different people, right? So inviting them in to be your support circle. And then they can sign up on the emotional support calendar for dates to do a check-in, right? The day before, Mothership Rising sends a text reminder to the supporter and says, hey, tomorrow you're supporting the parent. And then on the day of the support, Mothership Rising connects the parent with the supporter via text message, right? And this is really important because we want to relieve the burden from the parent to be the person who's going out and asking for support. We really believe check in on your postpartum people, check in on your parenting people, right? Be proactive. That's a real value. We're trying to remove all of the barriers that we talked about before. So, what does emotional support look like in this context? It can look like acknowledgement, it can look like encouragement, but I think what is key is supportive listening. So some of the hallmarks of supportive listening: being curious, asking questions, being empathetic, deferring judgment or advice, being focused on the person that you're there to support, refraining from shifting the conversation to your own experiences. And so this can be really helpful to have this framework, both as like the person who is supporting and the person who's being supported, because you can set a boundary. You can say, hey, I just want you to listen. Or you can say, hey, I'm not looking for any advice right now, right? You can say, hey, I just really want to vent. And that helps the people in our lives know how to support us, right? So instead of, if I'm supporting a friend, instead of sharing about the busy day I had, I could focus on her and how she's feeling today, right this moment. Instead of, listing the reasons why we're tired, because we're probably all tired, right? We can offer to hold the baby or clean up so she can nap, instead of offering advice on what works for us, which I think this is a really hard one because we want to do. And I think this comes from a really good, an honest place of supporting. But instead of that, giving her the space to vent about anything and maybe asking for permission if you really want to share something that worked for you. And instead of like telling her it's normal and kind of normalizing, in air quotes, what she's going through, just remind her that she's doing a really great job, that she's the best mom for this little kid. Right. So then when we think about who's in your community, right, we can think about intimate support, and that might be somebody that you would want to come into your home during those first few weeks, right? They might be somebody that you would be open to saying, like, yeah, hold the baby while I go and shower, right? And then non-intimate support, that might be somebody that you might say yes to if they say, hey, can I drop off groceries, right? And you get to have both of those. And I think what's, some misconceptions could be that it has to be everybody that you're super close to. I bet there are people in your life, who like are in your circle and would really like to support you in that non-intimate support kind of way, walking your dog, running an errand, picking up medicine from you from the pharmacy, or those types of practical support. Another misconception is that maybe it's just like our mom friends that we go to for support. So I really want to normalize that your non-mom friends are a great source of support. And they might have some more energy than your mom friends, to be honest. And then also this idea that it has to be a large group of people, right? Having 3 to 5, 7 people who are on your side and kind of in that postpartum period for you, who rally and say, hey, I'm on your team, like, is really valuable. And it doesn't have to be 15, 20 people to feel supported. And one thing I wanted to share, like, when we think about the reasons to ask for support, or the why behind asking for support. Yes, you get to be supported, and healthy parents create healthy families, and that creates healthy communities. One thing I wanted to really presence here, though, is that by asking for support, you give others permission to ask for support too. So you're creating this, tapestry of support in your community. And in this part of the tapestry, you're receiving the support. But we all know that in another season of life, you are going to probably be the person who that, your community is turning to for support. So it's really brave and courageous to be the first person to like raise your hand and say like, hey, I would love a little support here. So as we're kind of starting to wrap up before we go into our Q&A, I wanted to give you a closer look at how we're offering emotional support through Mothership Rising, and the emotional support calendar that you can see here. And we have a list of you to make it really easy. You just click on the I'll support, and then it adds to your, to your Google Calendar, your iCalendar, whatever calendar that you have on your phone. We also have the support wish list, right? So the support wish list is where we make it really easy for the supporters to know how to support. And we try to make it really easy for the parents to set boundaries and to ask for support for some of those things that like might feel a little bit awkward. In the support circle, there's a private chat, so it's a great place to keep your supporters all up to date. We also have a place where you can pin the message at the top, and when you pin it at the top, you can send it out like a broadcast to everybody. So if you have something urgent or really important that you want everybody to know, that's available to you. You can put photos here, and this is all encrypted and all private. We take privacy really seriously. We also have something called the Mothership Library, and this is a curated feed of articles and podcasts and videos, really focusing on the self-care of parents. And then we also have mental health resources that are easily accessible, so that when you need extra support, it's easy for you to access that. And what we're really proud of is just the community members. And so far, we have had, we have had 592 days of parents being directly supported by our circle members. And, for us, those aren't numbers. That's 592 days that actual people who were new moms, right, had their friends check in on them. And that's really what our mission is. And so, of course, this type of support, like we try to make it easy with the app, but if the app isn't your thing, you can just do a WhatsApp group or a text chain, or ask friends, to stop by or say like, hey, Carrie, could you check in on me every Tuesday? Like Tuesdays are your days to check into it. So this is available to you too in lots of different ways. This is just how we have, thought we could make it easy for community care. So I want to now turn it over to Christina and see if there's any questions or anything else.
Awesome, awesome, awesome. Thank you so much, Laura. And I hope everyone has really found this helpful to learn more about this app and learn more about how to support mothers and parents in the newborn phase. So important. And I think I thought of some things, we aren't taught self-care usually in birth and baby classes. And I know for me, that's something I definitely was not taught. I didn't know about it. I didn't know how important it was until it was almost too late. So I think this conversation is so crucial. And everybody can learn how we can support new mamas. And sometimes it is just, how are you doing? How are you feeling? Yeah. And not just asking one time, but asking twice or until you feel that you get an honest answer, because usually that first time, oh, I'm fine. Everything is fine. When I think 8 times out of 10, it's usually not fine. So just asking the questions and allowing that space for honesty. And the point that you brought up about, reaching out to non-mom friends. I think for new moms, we feel like, oh, they don't have kids. They may not understand. And but leaning on them, because they probably absolutely do have more energy. And leaning on them to do simple tasks, or not being afraid to reach out to those non-mom friends also. Um, let's see. So talking about Mothership Rising, who would be responsible, or who's the best person to set up a support circle?
So we have a couple different ways that we see it works. Sometimes the mom sets up. We have about 50% of our circles are set up by moms for themselves, right? And then the other 50% are either set up by a friend, or maybe a doula that is working with them as a host. When you set it up for yourself, you can also ask a friend to be a host for you, so that they can kind of take over the admin duties. Like they could invite people if you want them to, or they can do updates in the circle and make changes, especially like after the birth, when you're heavily in that postpartum period. It's helpful to have somebody who's acting as a host for you. But we, like I said, we have 50% are moms who are setting it up for themselves. It's really as simple as like setting up an Evite, right, or a Facebook event, right? Same process. You create the circle, you add members to the circle, and then you send them a text message. The app can help you send the text message. The app can send the text message, or you can copy and paste it and send it in your text, and then asking people to download the circle or the app. And it's totally free. And when they download the app, then they're automatically joined to the circle.
Awesome. I love that. And I think that y'all have done such a good job of removing the barriers and making it as easy as possible for whoever's supporting the parents or the family themselves. And like I said earlier, this conversation is so critical in how we support families with newborns. Another question, what has been, or have you seen, or have you been able to see what the primary requests are for support, other than reaching out via text or a phone call?
That's a great question. And we're just in the beginning of we've been around for a year. So we're just in the beginning of kind of getting meaningful insight around that. But we do see people adding information about self-care a lot. And we do see people adding in boundaries, like, please, we have a place that says, like, please don't offer advice unless asked, or please don't stop by without texting, or without scheduling it. So we are starting to see trends in those directions.
Awesome. I think that's incredibly valuable information that you are all gathering of what, especially during the pandemic, like what are extra things that mothers are requesting and asking for, because we all know the pandemic adds an extra layer of chaos.
That extra layer of isolation, which is why I started the app. Like, I had the idea after my son was born, but I felt too nervous to do it, right? But then when the pandemic came, I felt like, oh, I really got to put this out there in the world.
I love it. And I'm so glad that you did. Big fan. Let me make sure there are questions. LB Brown asks, what is the cost of your app or subscription?
Oh, it's free. It's totally free. We're committed to always having a free version.
Awesome. I wanted to reiterate that, since she did ask in the comments. Let's see. Do you know any perinatal mental health providers that utilize this app?
Yes. The ARC is using it. And the postpartum clinic is using it. So those are two of our partners.
Awesome. Excellent. I think there's another question in there. Have you gotten any feedback from the providers that do use it?
Well, so those partnerships have just launched, and we're really excited about that. But we did a research project with doulas last summer with our initial like MVP, and so from that launched us into the redesign that we did now, like adding the list view just to really show the focus on the emotional support. And then additionally, it prompted us and encouraged us to do a practical support calendar. The practical support calendar will be hopefully launched in May, and that's going to be more like your traditional kind of meal train plus. Right, where you'll be able to add requests for food, for running errands, for all of those practical things that you see in the support wish list. You'll be able to schedule in a practical calendar soon.
Awesome. That's so great. I think those are all the comments there, and I just checked the group too. And I think that's all the questions. But of course, if you all have any questions at all, pop them in the comments and we will get an answer for you. Yeah. And we're so grateful to Laura for taking the time out of her evening to share this with us. And I think it's such an important conversation for anyone to learn how we can better support families with newborns. So thank you, Laura.
Thank you. Yes. So, and what we find is, I guess kind of circling back to one of the other questions is that sometimes when people are hosting the circle, it's something that they might mention at a baby shower if the mom, has said like, oh, the people I'm inviting to this baby shower are people I'm going to invite to my circle. So that's a great time to say, hey, you're going to be getting this invitation from me. This is going to be a time that we can all focus on and support this new mom. And that can just help give a warm introduction, because it's a new idea. It's a new idea to encircle our parents with this type of care. And our circles are 100 days, because it is that thing that the first time you ask somebody, they'll probably be like, oh, I'm fine, right? And maybe actually the first couple of weeks, you have more support, you have people bringing over food, you have people stopping by, but maybe week 6, you might need some support, right? Week 8. So that's the other thing, is we really want to be there, kind of that bridge between those first 100 days, because around those first 100, after 3 months, you do see that's when you're going to start joining your mom and baby groups, right? That's where you're going to have a little bit more connection. So we want to fill that gap.
Yeah, I think that's so important. And what such an easy way to have a baby shower and have information just about it. So maybe people don't like to ask, and there are a lot of people that way, but you can have a QR code, scan it, join, easy peasy, and you're done. Well, not quite done, but you've got that ask without even opening your mouth.
Exactly. Well, we did want to make that really easy too, because we wanted to make it really simple for the people who were supporting, because you're probably going to, you have a lot of things that you're balancing. So I think that's also, a big value, is recognizing that people, who are supporting only have as much kind of emotional energy as well. But if I know, every other Tuesday I'm kind of supporting my friend, then I put some energy aside and save it for that. And I found that to be helpful when I've been a supporter in groups.
Yeah, absolutely. Well, Laura, I'm a big fan of Mothership Rising. I'm constantly sharing the resource, and
thank you.
The LB Brown also said, this is amazing. Thank you so much. And I look forward to using and recommending this. So we appreciate you tuning in and asking questions and being engaged. But like I said, if there are any questions, put them in the chat and we will get an answer. Otherwise, Laura, tell them where they can find you and follow you.
Okay, great. Mothership Rising is available for download on both the App Store and Google Play. It is available in the US and Canada with this specific texting resource. There's no advertising on it, and it is free for both hosts, parents, and supporters. And a great place to find us is on our Instagram, which is at Mothership Rising.
Awesome. Well, thank you so much, Laura. Everybody, we hope this was helpful and beneficial.
Yeah.
And if there's something you resonated with, please leave it in the comments or just say thank you or hey, so we can know that you watched it. And we will be done for now, and we'll see you next week.
Great. Thanks so much.